After cancer, most people want to move on. Will started feeding fish, twisting wire into trees, and trying to make sense of what was left. This isn't a story about beating cancer, it's about what comes after, and how something small, a fish, a wire, a habit can keep you going.
Tranquility, peace, mindfulness, reflection. Yeah, it's just a sense of making sure that the koi are good every day and keep me mind busy and active as well.
Before all this, Will was just a regular koi keeper. A few fish, no big ambition, just the rhythm of looking after something that relies on you.
Start of a little pre-form thing. I filled it with shabumpkins. The next morning I came down, I went, where's the shabumpkins gone? And there was these little claw prints. And I went, nah, what's that? No shabumpkins left. So, yeah. Now that I know it was a heron that took the lot, so. And then, I think this is me 4th pond then. I want another one.
Then came the diagnosis, blood cancer. The kind of treatment that breaks you down to rebuild you.
I went to the hospital, which was lucky enough 10 minutes away from here. And he said I had MDS, never heard of it in my life, which is myelodysplastic syndrome. It's a rare form of blood cancer. And I just said to him, I said, what is that, doc? And he went, you got blood cancer, Will. And yeah, he said, you're in for a tough couple of years.
Everything stopped. His world became numbers, waiting rooms, and waiting for the next treatment.
Pond life. It was just a massive. I just couldn't believe it. I just thought no one thinks it's going to happen to them until it does. And then I've always said I would always try and do as much as I can to help someone else on their journey or anything like that. I struggled, and I think my dad bought me the big long pond gloves. He bought me that, and I was just scared to go near that because of the infection rate and that. And your health has to come first.
Eventually something changed. The transplant took, his body started coming back, and so did the need for routine.
If I was feeling upset or run down or anxious, yeah, it's great escape. And then just looking out of the window, watching the koi, it's who wouldn't want to do that?
Somewhere in the middle of recovery, Will picked up a roll of wire. No goal, just something that required patience.
I was watching YouTube videos and watching the Japanese, the Vietnamese make these outstanding trees. And I just said to myself, I'd love to make one of them. I'm going to try and make one of them. And you know what? I actually stripped the plug to use, the plug wire to get the wire out of it. It failed, but yeah, I just started learning and investigated how to get the wire and different techniques of making them. And yeah, even to the day, I'm learning.
The tree started to take shape. The pond cleared. Life wasn't exciting, but it was starting to feel like something again.
Therapy, definitely therapy. It's mindfulness, it's escape. It's just, I actually love making them, and it's whatever will come into my mind, it will never finish the way I want it to, which is good because every tree that I make is different. So yeah, if I can come in here, create something that's going to make someone happy, then brilliant. The finished article, the finished product, creating it and then making it and then watching it be at someone else's pond. I love that. That's nice. I love that.
The news finally came. The transplant had worked. He was clear.
This was Dr. Saif. Love him. Called me in, and it was, I think, a year after. We brought up the charts of your bloods and your hemoglobin and that, and the platelets and etc. And he just turned around and he went, I'm gonna get upset. He took my hand and he said, "Will, you're in remission. Well done." And yeah, he said, "There's a long way to go yet, by far. But you're not out of it." And all to the day, they're still looking after me.
But the fear doesn't go. It just sits in the background, quiet, waiting.
Yesterday, I had a little rash on my chest. Is it? Because I'm at over the 4-year stage now, and if you read into things, that's when a lot of transplant patients go downhill. But yeah, I don't think there's a day that I don't worry about it.
There was a stretch where he stopped. No fish, no wire, no purpose.
I got sepsis in my finger. I opened a bottle of mouthwash, and a little tiny nick turned into a major operation. The surgeons had to come in, and he just turned around and he went, "Close your eyes, grit your teeth," and he went into the finger and took all the stuff out, the gump out, and yeah, I was upset and annoyed at myself for that, but it could not have been helped. It was just one of them things.
And then, without fanfare, he came back. One wire, one feeding, one small task that turned into another.
I enjoy making them. I actually really do enjoy making them. And I'm sitting here looking at that one now thinking, that leaf's out of shape, I need to refix it. But yeah, I really do enjoy making them, and each tree is uniquely different that I make. There's not one tree that I've made which is the same, I don't think.
The pond runs clean. The trees hold their shape. Will isn't trying to inspire anyone. He's just here.
The self-belief that you're gonna do it, get through it, and each day I still wake up. Thank God I'm alive. Thank God I'm still here.
This isn't about winning or losing. It's about shaping what's left and carrying on.